it's no news that the cholera outbreak has been all over the place. Okay, and then the information reaching us now is that the Nigerian Center for Disease Control and Prevention, that's the NCDC, has alerted on increasing cholera cases nationwide, with 30 deaths, 1,141 suspected, and 65 confirmed cases reported. Disclosing this in the public advisory, the Director General of the Center, Dr. Jide Idris, said the case, which occurred between January and June 11, 2024, were reported from 96 local government areas in 30 states. He stated that the 10 states that contributed to 90% of the burden of cholera include Bayelsa, Zamfara, Abia, Cross River, Bauchi, Delta, Katsina, Imo, Nasarawa, and Lagos. Joining us over the phone with us to discuss this issue of cholera outbreak with us over the phone is Dr. Godwin Iche, General Medical Practitioner and Public Health Physician. Good morning, Doctor, and welcome to the program.
Good morning, Chris. Thank you for having me.
Yeah, it's really nice to have you. Of course, you are in the medical field and would like to know, please explain to us in layman's terms, what is cholera?
Okay, thank you so much, Chris, for having me in the show this morning. In a layman term, cholera means and is a diarrhea disease, simply that is caused by the ingestion of food or water that is contaminated by the bacteria that causes this cholera. So in a layman's terms, that is what cholera is about. It's about ingestion of food or water that is contaminated by a vibrio cholera. That's the bacteria that causes the disease called cholera.
All right. Thank you so much. So what are the symptoms, or shall I say signs, of someone having cholera?
Okay. First of all, one of the early signs, we have the early signs and the late symptoms of this cholera disease. So one of the early signs of cholera, first of all, let me mention that in most cases, there is usually a carrier. The person has the vibrio cholera in his or her feces, but the person doesn't have any symptom. So in most cases, people are asymptomatic. They just shed this bacteria in their feces, and then it can get contaminated. The next person can get contaminated. Now, usually when people develop this symptom, they usually develop this symptom in most cases between 12 and 5 days. We call it the incubation period. Between 12 hours and 5 days, they usually come up with early symptom. And of course, the first symptom I want to mention is watery diarrhea. Watery diarrhea, especially a diarrhea that is very, very loose. We call it the rice water stool because it's usually milky. It's usually milkish white in nature. So that's one of the first symptoms of this cholera. We also have vomiting as well, and then we have restlessness. Find out that most patients that have this cholera, they are restless. And then, of course, if left untreated, of course, we know that when a patient is having persistent diarrhea, the person is losing bodily fluids, and this can cause dehydration and also cause shock. We call it the hypovolemic shock. And of course, it will be important for me to mention here that if these symptoms are present and there is no prompt adequate medical attention, it can lead to death. That's why from your preamble, you mentioned that, of course, we already have up to 30 deaths in the country. Cholera is very, very treatable if the sign is noticed on time, and then the patient seeks attention. It can be brought under control by using oral radiation salts and appropriate antibiotics.
Thank you very much, Doctor. Once again, thank you for joining us and sharing your expertise on the program. Dr. Godwin Iche, General Medical Practitioner and Public Health Physician, talking to us about cholera this morning for us to be aware, because all around Nigeria, the government is raising awareness for cholera. Doctor, please take us through, re-emphasize on the cause of cholera once again, please.
Okay, I said cholera. Cholera is caused by ingesting food or contaminated water. Any food that is contaminated by the bacteria that causes cholera, the patient can come up with cholera. So cholera can be gotten by ingesting food or contaminated water that is contaminated with the bacteria.
Thank you very much, doctor. Okay, let's look at the preventive measures to take to avoid contracting cholera. What are the preventive measures? What are preventive measures our listeners can take to avoid contracting cholera?
Okay, thank you so much. Once again, as a public health physician, prevention is key for me. So what I want to advise the general public is that, first of all, for cholera, one of the first is to ensure good sanitation and hygiene. Well, we need to wash our hands regularly, especially after using the toilet, and then we also need to drink safe water. Safe water is also very, very important in preventing this disease. So general hygiene, washing of hands regularly with soap and water, drinking of safe water, and as well, we also have the vaccine. The vaccine is there, and I know in at some point when we had an outbreak in Bauchi State, specifically in the year 2021, there was a massive supply of the cholera vaccine. So that also helped in controlling and preventing the disease at that time. So my preventive measures are: one, sanitation, good sanitation and hygiene, drinking of safe water. Let's ensure that with the water we drink is safe and clean, and also our environment should also be clean. So these are the necessary steps to take to prevent cholera.
All right, thank you so much, Doctor. In a few seconds, do you have any parting shots that you'd like to talk about before we leave?
Okay, my parting shot would be that, of course, cholera. First of all, cholera is a bacterial disease, like I've mentioned, and it can be treated properly and completely cured, of course, if it is detected on time, if we seek attention on time. And of course, I would like to mention here that at this time, where we're having an outbreak in Nigeria, we already have up to 30 deaths from this bacterial infection. So I would like to mention that anybody that is having any diarrhea of greater than three episodes should seek attention on time. Because if attention is the right medical attention is sought on time, this cholera can be treated. And of course, I would also like to mention that if left untreated, it can kill. It can kill within hours, because the diarrhea is usually very rapid, and it throw you to dehydration and throw the patient to shock and of course death. So my party shot again is to say that the public should be aware of this bacterial infection, and of course it remains a public health threat as of today. So people should observe maximum hygiene, should drink safe water, clean their environment, and of course avoid crowded settlements to avoid this cholera infection. Thank you so much.
All right, thank you so much, Dr. Godwin Iche. Thank you so very much for joining us this morning. We look forward to doing this with you some other time. Have yourself a pleasant day.
Thank you.
All right, Chris. All right, then, you stay tuned to Rainbow 94.1 FM. This is newspaper headlines and editorial. In a few seconds, we'll come back and take the news dailies. Please don't go nowhere.
How does killing two birds with one stone sound? Let me tell you how.